Good morning, ladies and gentlemen. On behalf of Medwiz, I welcome you all, those present here and those watching us live through webinar, for this free seminar on the USMLE roadmap. Let me start the proceedings by inviting our honorable guest for the day, Dr. Rahul Pannala.
Good morning.
Today's esteemed guest speaker and our honorable partner from the United States of America, Dr. Rahul Pannala. Dr. Rahul Pannala is Assistant Professor of Medicine and a consultant gastroenterologist at the Mayo Clinic, Arizona. It is our pleasure to have him amidst us. Being part of a group of doctors who have successfully traveled the USMLE route in USA, Dr. Pannala has an exhaustive experience in guiding hundreds of students, conducting mock interviews, and assessing their comprehensive preparedness for USMLE. With more than 6 years of experience in mentoring residents and fellows, he surely is in a position to give today an informative presentation on USMLE. Dr. Rahul Pannala, ladies and gentlemen.
Thank you. Thank you. So good morning, everyone. It's an absolute pleasure to be here. Thank you for those who are present here and for those who are attending online. What I hope to do over the next 30 minutes or so is to give you a real overview of what the roadmap is and hopefully give you some strategies for success and an idea of what this entails and how you can also go about the USMLE pathway and succeed and make all of your dreams come true. So let's get started. We'll talk about some steps, resources, and a game plan for your ultimate thing, which would be a successful match to your residency of choice. So the steps, there's clinical skills, the CK, and the rest. What will you need to do and where to start? And also we'll tell you how we can help achieve your dreams and hopefully be a partner in this pathway for you. So let's start by looking at some information about the USMLE, about the residency match. You know, there is the demand-supply gap is a reality. That obviously, as you all know, there are more applicants who are applying than their match positions, than their residency spots. So as you can see here, the green is the number of applicants who've been applying for the match, and obviously the number of the PGY1 positions or the postgraduate year 1 positions are relatively stable. They're inching up slowly, but in general they've been relatively stable. So what does that mean for you? It means that you have a fairly challenging road ahead. But the good part is that if you look at this map from the NRMP, the international medical graduates match rate has remained relatively constant, and that's about 50%. And to put that into perspective, 50% is pretty good. So 1 in 2 of an international medical graduate typically matches into a residency of their choice. So if you look at this is the orange bar is the non-US graduate, and it usually approaches around 50%. I mean, there's ups and downs. But what has happened recently is we have seen an uptick in the number of international medical graduates who are getting a successful match. So there's really a lot of hope. It's obviously going to be a very challenging thing, but you've all been through multiple exams, multiple things, and overall these odds are much better than many other odds that you've faced in terms of exams here in outside of the US. So where do international medical graduates usually target? The most common is internal medicine. The other ones are pediatrics, family medicine, psychiatry, neurology. I mean, neurology is getting very, very competitive, as is psychiatry. Internal medicine has always been very competitive. So each of these specialties have their own unique challenges, and you have to target how you're going to go about it, depending on which specialty you're trying to target. Now, for international medical graduates or IMGs, some factors are very, very important. The first are the scores. You have to do well on your USMLEs. If you don't do well on your USMLEs, or you don't pass your exams on the first attempt, then it may becomes that much harder, because at the end of the day, they're going to look at the entire portfolio. So scores are a very important component of that portfolio. The other most important thing that has really become absolutely necessary is that you need to have US clinical experience. It was not that important a few years ago, but these days, when I look at CVs, most students have had at least 6 to 8 months of US clinical experience. So that's something you should be planning for. Again, these are all the components that go into a successful application. Electives, your visa status obviously becomes important. The other important thing is letters of recommendation, and that's clearly tied to your US clinical experience. You have to do well, you have to have that experience, you have to get those letters of recommendation. Year of graduation, the more recent your year of graduation, the higher chance you have to match and you should try to avoid any gaps in your CV. And the other important thing that we'll touch upon briefly is to have some research experience. Research is very, very highly valued, and it's something that will be a key differentiator, like I'll talk about. So first, let's focus on the exams. Obviously, many of you know about this, but it's typically a 4-step process to get licensed and to be able to apply for a residency. And these exams are designed to test your knowledge, to test your concepts, to test your clinical acumen. So each of these exams targets a different component of your training. And each exam complements the others. So what step 1 is testing is different from what step 2 is testing. And in the end, you have to demonstrate competence in all of these aspects. And that's how you have to plan. Now, step 1 is an 8-hour exam, and folks here, Dr. Banu and others know more about this and can tell you it's about you get about 45 minutes plus 15 minutes of break time, about 280 questions or less. You get 7 blocks, and really you go through each block, and you have to be able to understand the exam, how the exam day is, what is being tested, so that you have the best chance of success. And you have to very strategize not just how you take the exam, from your medical knowledge point of view, but also how to be successful on the day of the examination. The subjects that are covered are usually your first 2 to 3 years of medical school, so the basic sciences: anatomy, physiology, biochemistry, microbiology, pathology, pharmacology, behavior science, and biostatistics and epidemiology. Traditionally, in international medical schools, except for certain exceptions, the last two, especially behavioral sciences and biostatistics and epidemiology, are not really taught that well. So it's something that you really have to focus on, because you'll see that on your exam. And obviously, this is not, these subjects are not the most exciting. You want to do clinical things, you want to do, but this is very, very important because it forms the basis of your clinical skills and how you apply it. And the other important thing which you will also have to realize, it's not just a memorization of facts. It's not just, let's say anatomy. You have to be able to apply that clinically, because on your exam, they're not going to ask you what the name of a nerve is that supplies this limb. They're going to ask you why that is important, and that's going to be different from a lot of the exams that you take, let's say outside of the US, where they're more focused on how much knowledge you have. But really, in the US, the core thing that guides us is, are you able to apply that knowledge clinically? And that's what these exams are testing. So there's a whole spectrum of scores. Obviously, it's a bell-shaped curve, and you want to be on as much of the right side of the curve as possible. This is sort of a mean scores that gives you by specialty. The more competitive the specialty, you need to have a higher score. Even for internal medicine, I would say really pay attention to your exams. You need as high a score as you possibly can get, and that'll make your life that much easier. And this graph is very, very powerful. It just tells you the higher your score, the higher the probability of you matching. So if you're in the 250s, you have a higher probabilities right straight out of the bat than if you're in your 220s or 230s. And that makes sense, but that is so true. So pay attention to these exams and do well. You get one shot at these exams. Now, there's a wide spectrum of resources. I'm not going to go into in detail of every one of this, but these are there. There, pluses and minuses of every resource, and I'll tell you a little bit of how we can do things differently. How we, basically, we want to change the paradigm of how you prepare for these exams and make it easier and make you learn this information, not just for the exam, but also to be better doctors. So, you can go through all these resources, and they have a collection of facts. But I just want to sort of then finish off step 2, and I'll go over how we can do things differently. Step 2 is a very similar. It's about a 9-hour exam. This is more of a clinical thing. It's divided into 8 blocks. Touches on your clinical subjects like obstetrics, gynecology, pediatrics, surgery. Internal medicine forms obviously the bulk of the exam. And then again, some of these things that are not taught very well outside of the US or in many medical schools is psychiatry, epidemiology, medical ethics, which I think is very, very critical because that really becomes important. It's tested on your exam, it's tested in interviews, it's tested in multiple steps of the process. And again, lots of resources, different people spend different amounts of time preparing for these exams, so you have to do what works for you. Again, these resources, but I just want to change focus a little bit and say how we can do things differently. And we are very fortunate to collaborate with Dr. Banu and the group with Medivis. What they're doing is a very highly successful Step 1 and Step 2 CK program. And they're really approaching it in a multifaceted manner with live lectures, webinars, interactive webinars, and it's a rolling start where you can start when you're starting out. And I think most importantly, which I've highlighted here, which may or may not show up very well in the red, is that it's not just a memorization of facts, but to be able to apply that to clinical case scenarios, because not learning a bunch of facts is not going to help you on the exam unless you're able to apply it. The other important thing is test-taking strategies. Some people are better test takers than others, but these skills can be taught. And it's very important to acquire those skills of understanding how a question is written, what exactly a question is trying to ask. Now, they have a 10-week intensive course exam for both exams. They go Monday through Saturday for about 4 hours a day, reinforce really high-yield facts with lecture notes, question banks with explanations, but more importantly, again, I think more than 3,000 case scenarios, because nearly every question on your exam is going to be about a case. It's very, very few questions who are going to just say, give me a fact. Now, moving on to Step 2 CS, which is the clinical aspect of it, and I think which can be very challenging for folks who have trained outside the US. This exam is designed to test your ability to apply a fundamental knowledge base by communicating with mock patients. So how you're going to interact with patients, and you have to not only extract the information, but you have to generate a basic differential diagnosis and give a workup plan of how you're going to help take care of these patients. Again, it's an 8-hour exam, standardized patients. Patients are actors who are very well trained to describe signs and symptoms. History taking, you're tested on history taking, physical examination, how you close, how you do a patient note. So there are multiple components to this exam that you have to really focus on. Now, when to take it and where? Again, this becomes very important. We suggest that you take it after you've done some clerkships in the US, so you know how the system works, how you interact with the patients. The center and location really doesn't matter because all of it is standardized. It doesn't matter as long as you study properly. Um, Houston seems to be the most popular for international graduates because there's a collection of, folks who stay close to the exam center and try to take it. But if you've prepared well, it really doesn't matter where you take the exam. These are the centers that offer the exam, so they're spread all across the country. I would suggest that you take one that's most convenient for you. You don't have to travel to a place that's not convenient for you. What is more important, however, is to strategize the timing of the exam. So it takes time for these results to come. So for example, if you're going to apply for the match, you need to pay attention to the date so that you have the results of the exam before you're applying for the match. Because the most common mistake we see is incomplete applications. Now, the grading for this is done on all the exam components. The standardized patients will score you for each subcomponent, so you really have to pay attention about test-taking strategies. Some really, really smart people fail this exam because they don't pay attention to the test strategy. So this is not so much a clinical knowledge exam, but how you apply within the structure of the exam. Again, the usual resources, the first aids, the study partners, the mnemonics, booklets. Most important is practice, understanding how the exam is structured, and really reading to the exam. Now, what are the most common mistakes that we've seen? One is not practicing enough with patient scenarios before taking the actual exam. Two is not having a plan. You need a logical plan of attack and based on the patient doorway information. So every case is designed to ask and test something different. It may, the patient may come in with a cough, but the case may be designed to completely test nothing about cough, but about how you interact with the patient. Is the patient, depressed? Did you understand that the patient is depressed? And the cough may just be a marker of the patient coming in with depression. They'll have enough clues there. But the point is, if you focus too much on the cough, you miss the big picture. Now, that's where I mean by failing to understand the objectives of the case. And it'll be there. It's not something you have to guess. The exam is designed and the way it's written is that if you follow the clues that you're given, then you'll be able to crack the case. Managing time is very, very important. Being flustered, one of the cases could be an angry patient. And patient is angry at you, but that's what it's meant to be. That's the objective. They're not angry at you personally. They're angry, patient. So understanding that, addressing that, and saying, Mr. Smith, I see that you're very angry. Can I help you understand? Can I help, what can I help you with? So that becomes very, very important. And then taking unfocused physical history or unfocused clinical history and examinations, failing to understand how to interact. You're obviously coming into a different culture, a different system. So that needs some preparation, that needs some understanding. And not carrying out easy patient interactions. So pay attention to that exam. It's something that trips up even really smart people. Now, step 3 is somewhat different. It's really very clinically focused. It's a 2-day examination. Again, going back to multiple choice questions, but the other component is the clinical case scenarios. And step 3 is something that you take towards the end, so you've really become adept at taking exams. So it's something that most people tend to do very well, but you do have to prepare for it very differently because you're actually managing a case electronically. And you're advancing or not advancing, and it's an interactive thing where the case changes based on what you're doing. And we would suggest that you take it as soon after your clinical CK exam because you're very fresh. A lot of the same material is being tested, but you really have to individualize and see how that works for you. Typically, it takes about 2 to 3 months to prepare, and I think it's very important to take your step 3 before you apply because what then happens is it differentiates you from the other applicants. So that way you have the entire portfolio. If I'm a program director, I'm more inclined to look at a student who has done everything and has done well in everything. Again, there are lots of resources. The CCS cases are very, very important and how having a strategy to address those is very important. And we always suggest taking a step 3 before residency, especially for international graduates, because that really strengthens your application. Now, changing gears a little bit, going on to the other aspects of your application that are going to make or break, and not just the scores. One is US clinical experience. It usually comes in 3 different forms. One is clerkships, observerships, and externships. Clerkships are obviously very, very preferred. They usually after your 4th year, but before graduation, you get hands-on clinical experience. If you really do well on your clerkships, you have a very high chance of getting a good letter of recommendation, so something to really work at. Observerships are after graduation. Typically, it's not hands-on. You just observe or follow a doctor. They're not really that highly rated, but can be very effective. A lot of people use this to network, to form relationships, get research opportunities. So it's really up to you of how much you do. Externships, again, are very helpful, hands-on, can be in private clinics or hospitals, but this can help you get letters of recommendation. And we suggest about at least a 6 months of US clinical experience for a very strong application. Doesn't have to be, there's no magic number. It's a complete application, but shoot for as much as you can. And during each rotation, you really have to put the effort. It's not enough to just show up. You have to work. You have to work really hard. You have to go above and beyond, because that's what the US graduates are doing to get those letters of recommendation. You have to think like, that you're from there. And that's how, initiative and taking action, going above and beyond, it's always, always valued. And that's what people look for. Some pointers you really want to study. I look at it and I would suggest think of it like this is the time to showcase you as a clinician, your medical knowledge. You have to study. It's not just enough to show up. And you would be surprised of how people don't use the opportunities that they're given. You have to be an active participant, learn your team, get to know your team, be proactive, ask questions, volunteer to do the work, give case presentations, say you'll write a case report. Do go over, above, and beyond. And if you think you're going above and beyond, do some more. Okay? Dress smartly, act professionally. You're in a different environment. How you do, things people are coming from different countries, different things, but you have to fit in with the system there, right? So it's not, you have to be very, very professional. And I put here no texting because you'd be surprised. Like I have seen when I'm sort of doing a case or I'm talking to people and I have a student in the room, they're texting on their mobile phone. Sounds simple, sounds silly, but you'd be surprised. It goes back to acting professionally. So, people watching this, put that phone away. Be professional, show up with 120%, because 100% is not going to cut it. Volunteer, like we talked about, and develop a rapport with the other team members. Volunteer, take some of the work from the intern. They'll go and talk to the attending and say, that clerk, the extern, he or she went really above and beyond. So that's going to be very, very important. Now, strategy is very important. As with anything in life, strategic planning for a successful match is going to be very, very important. This is one game plan that we suggest. You finish your MBBS exams, you take your step 1. Again, this is very variable. But you take your step 2, do some clinical experience, US clinical experience. Then you take your step 2 CK, step 3 before the match, so that when you apply, you have a complete application. And you really have to strategize and stick to that plan. And this is one example of the timeline that we have seen students do very successfully. So if you're in July, we'll talk about CV and the personal statement, how you can really focus on that, and that's where we can help you. You certify and submit your application, then you do your interviews, and that way, once you've done your interviews, you're in a very successful position to be able to match, and then you've really done well, and that's the start of your medical career in the US. So moving on to one of these things, I want to cover very high level and what needs to be done. The CV and the personal statement is very, very important. It needs time. You have to take the time and the effort to put it all together. You have to plan ahead of time so that you have what is needed to make your CV stand out. And the setting, you have to talk about your medical school, because the person sitting in the US doesn't know your medical school. So you have to tell them how competitive that medical school is, how hard you had to work to get in, what the setting is, how many patients you were seeing. And you have to describe your US clinical experience very effectively. And you have to have volunteer experiences, and you have to be able to describe those volunteer experiences so that the person reading it knows that you've gone above and beyond than an average medical student. Now, impactful ERAS application is very, very crucial. We see this all the time. There's a very bland description of activities. I took history, I did a physical, I did this, I did that. That's boring. You need to make it pop. You need to make it stand out. You have to focus on what impact. If you're doing a volunteer work, you went to a village, you did this. It's not enough to say, I went to a village and I gave pulse polio, or I did this, or I did that. How many people did you touch? What is the impact you've done? How many people, what are the outcomes that you have shown? That's what people are interested in. So, you have to showcase your personality. You maybe have unique hobbies. When you apply for residency, we are looking for people who are diverse. We're not just looking for the people who have the most medical knowledge. We're looking for a diverse group. So maybe you are a wonderful world-class painter. That's important. That's going to help you stand out. Maybe you have a degree in music. Maybe you have something else. So people are looking for unique experiences. And if you have that, make sure you highlight that. The most common thing we see is this generic description about hobbies and interests. I like playing cricket, I watch TV, I like movies. If I'm a program director and I'm reading that, that doesn't help me pick you from the next person who may have a degree in music, who's gone out and helped, poor kids in an orphanage. If you're sitting in this side of the chair, who are you going to pick? Somebody who's gone above and beyond, and somebody who can talk about that, right? So focus on that. That's very, very important. The same thing with your personal statement. The personal statement must tell your story. Avoid cliches. Don't copy it from the internet. People know how to read it. We've seen hundreds and hundreds of students. They take 30 seconds to read a personal statement. They can say if you've copied it from the internet. So it's very, very important. This has to be original, and it has to be an inventory of your personal and professional experiences. And again, I want to spend about a couple of minutes on research, because as an international graduate, again, you have to go above and beyond. You have to show research can be a very important differentiator. So if you can get involved in medical school or when you come to the US, I think that's very, very important. US research is more valuable than your home country research, but you have to show output. You have to show that you presented a poster, you have a publication, you have to show outcomes. And I think the other thing that you can do, going back to your exams, how they test on biostatistics and epidemiology, having some of those skills can be a very important differentiator. So something that you can start thinking about from your third year of medical school. And then going on to interview preparation, this is very sort of challenging for people because it's a different culture. Interviews start typically in October and end in January. The interview type and experience can vary a lot. It's a very stressful time. You have to travel, and community programs interview differently. University programs interview differently. Some people ask medical questions. Some people don't ask medical questions. So it's a lot of stress. It's very different from what you have done. You have to interact with the residents, and so this can be very, very challenging. And international medical graduates, in our experience, do need a lot of preparation. And see, people are interviewing every 30 minutes. So you have to be able to stand out. You have to have unique responses. You have to have that confidence, the social skills, that they can work with you for the next 3 years. Because once you come in, they are going to be working with you day in and day out. And so they need to have that comfort, and the stock responses really put interviewers off. So it needs to be unique. And then in terms of the match, I just wanted to give you sort of an overview of the match, of how it works, because then after you have done all this, they sit and talk, and they have to decide how they're going to pick the candidates, and you have to decide which programs you want to apply to. It's a blinded process, which I think is very, very fair to both the applicant and to the program. The candidate ranks the program in the order of their preference, and the programs rank the candidates in their order of the preference, and it's a computerized algorithm that makes a match. So it's very, very fair, and the result is binding to both applicants and programs. So how you strategize your rank order list can also be very important, because then you have to see what you like, what your probability of matching there, and you have to put that strategy in terms of your rank order list. The common pitfalls, again, not just, and this applies for the entire process, is poor planning, poor preparation, a weak application, applying with an incomplete application, so not planning the exams, you don't have the results when you're putting the application, attempts, insufficient US experience, not getting a good letter of recommendation, and lack of guidance, I think, in this process. These are the common pitfalls that we have seen. So some final thoughts: start early, differentiate yourself. How are you different from the person sitting next to you? Electives and externships are rated higher. Get as much as you can, and everything on the application is fair game for the interviews. So if I'm sitting across from you and I see something in your application like you failed step 1 once, then I'm going to ask you about it because I want to know, and everything is fair game. Unique hobbies, volunteer experiences, again going back to how you differentiate yourself is very important, and having a very impactful application, a personal statement, and apply with a complete application. Again, I keep saying that over and over again because that's one of the most common mistakes we see. Then also when you come to interviews, canned answers, scripted answers, practice and practice for the interviews. Finally, be confident, be yourself, and use all the resources you have access to. So in the last minute or so, I just want to focus on what we can help you do differently. I think in collaboration with our partners here with Medivis, what we want to offer, I think, is an end-to-end strategy. So if you decide you want to seek a higher education, you want to get to residency in the US, you have one resource, you have one trusted resource that you can turn to, and that you're not scrambling to get all the information and trying to scrap together all this, so that you can focus on your preparation, you can focus on putting your best foot forward. So for exam preparation, like I said, Medivis does a great job, and they're really approaching this in a very unique manner, which I think helps you understand the concepts. What we want to offer is a seamless transition then to the other components of your application, like the US clinical experience, the application process, and from what we do. So a little bit about us, which is USMLE Sarthi. We're all international graduates who've graduated from reputed medical schools both in India and elsewhere. It's sort of a multinational sort of a group that we are putting together. We're selecting people who are very, very interested in helping students, mentor, and who have experience with mentoring students, residents, fellows at major academic centers. And we're seeking out and seeking collaborations to provide this end-to-end service with very, very trusted partners so that you get a high-quality experience. When students come to us, it's a very personalized interaction. You get a one-to-one interaction. You're assigned a mentor. That mentor is the same mentor, along with other panel members, that you can turn to, and they are going to guide you across every step of the process. We start right off the bat with the ERAS application, the CV preparation, how you do it. We're not a writing service where you don't just send us your information and we give you a fully minted personal statement. That's not what we do. We help you write and make the best put the best application forward, put your best personal statement, we work with you. We engage journalists, linguistic experts, things like that, really out of the box resources to help you get to that next level. Again, personal advice then comes to which programs do I apply to. These are my scores. This is my application. What is the most, what is the strategy? How do we apply? Where do I apply? And then coming to interview preparation, we do webinars, we do one-on-one mock interviews, we give resources, we connect you with other students who are in the same boat for you guys to practice, which really helps with networking. And once you are there and you're going through the process, having that support system of your peers really becomes very, very organic so that each one helps everyone else. And we also connected with previously math students to get some feedback of what really worked, what didn't work. So that's sort of where we are coming from. We want to provide a very high quality experience that you can trust, and you can do that. And with collaborators who have the same high level of quality, because we want you to be successful in the end. So this is some of the contact information. You can call, email, Facebook, WhatsApp, whatever works best for you. And we have a lot of information that we can provide. So I really hope that we want to change the landscape here of the resource so that you have something that you have that you can go to very easily. Thank you very much for your attention. Appreciate it. And thank you. Do you want to take questions, Lee? Yeah.
That was a very informative presentation, Dr. Pannala. I hope it has clarified many of the doubts that students have regarding the entire USMLE process. Now we invite the students to ask questions, and those watching us on webinar, please type in your questions and Dr. Pannala will surely answer them.
Can you speak a little louder? Thank you. Yeah. You might want to use the mic.
I'm just done with my step 1 of the USMLE. I'm starting my step 2 now. Hopefully. So my question for you today is, there's a lot of fuss going on in the US regarding the immigration process and the visas and all this. So how should I be looking forward in time, maybe 2 years down the line from today, as to because I come from a Muslim background, so there's a lot of this thing going on, like we're seeing it in the newspapers, in the news all over, regarding Mr. Trump's various policies. So how should I be looking towards this particular aspect?
Yeah, so what I say is I have a crystal ball and it's cloudy.